Hello, everyone, and today we will discuss the important topic of CPR and first aid. Here are some important facts you will need to know about first aid and specifically CPR. 50% of office employees do not know where to find the AED in their very own office. Second, while certain states require all teachers to be CPR and first aid certified, not all states follow this requirement. The chances of survival can increase threefold when CPR is used within only 6 to 7 minutes, and can increase 4 times when an AED is applied within only 2 minutes. All of this should make you want to learn CPR and can dramatically increase the chances of someone living. Let's specifically talk about cardiac arrest. Cardiac arrest is different from a heart attack because in a heart attack, the veins that feed the heart blood, yes, the heart has to pump itself its own blood too, can get clogged, causing the heart to fail, for lack of better words, due to a lack of oxygen. This means the heart is not getting any oxygen to the muscles to pump and therefore cannot continue to pump blood to the rest of the body. With cardiac arrest, however, the veins and the arterioles are all in very good condition. However, it is the electrical portion of the heart that will malfunction. The electrical portion times the beats of the heart, and when this is malfunctioning, this can cause an arrhythmia and even heart failure. In this case, when the heart has a little help, it will be able on how it is supposed to beat. There is a much higher chance of survival. With that being said, when an AED is applied and used on this person, the heart can actually reset and ideally start pumping at a normal rate again. A lot of you might be scared to perform CPR, but I'm going to educate you step by step on how to safely and effectively perform CPR. There are lots of steps to CPR, so let's start with the very first step. What is important about CPR? The first thing is to be aware of your surroundings. Sadly, if you do not see the pale person or you do not see that the scene is safe, you cannot even begin to help the individual who is in need. You must learn to be observant and to read the signs. For teachers, this can be as simple as looking up and scanning the classroom. Sometimes you will not always see what happened, but you can look around and notice different things in the room, like a ladder, maybe that someone has fallen off of, or maybe the individual who is unconscious has on a medical bracelet. Both of these things, any of these things, will help you get a jump start on the situation at hand. Once you notice that something is not right, it is imperative that you call 911. It is better to send the ambulance and the EMTs away than to not have them arrive in time. At this point, you will send someone else to go find an AED, and you will give another person the phone to continue to talk to EMS. Having other people help you during an emergency situation is always better than trying to handle it on your own. Next, you need to know the signs and symptoms. That sounds intense, but there are a few that are very clear and very helpful to understand whether a person is in need of CPR or not. There are a few that are important, and even if you are unsure how to exactly diagnose a victim, then at least you will understand that you are not hurting them, which sadly seems to be most people's fears when it comes to administering CPR. First, check for ABCs. This is a simple and easy way to help you remember the things you need to look for when assessing someone who is unconscious. The ABCs stand for airway, breathing, and circulation. Airway. does the victim have anything blocking their airway or anything crushing it from the outside? Both of these can be an indication of choking and possibly just a lack of oxygen to this individual. You ask yourself, yes or no. Breathing. Do you see the chest rise and fall? Can you feel air coming out of their nose or out of their mouth? Again, you ask yourself, yes or no. Lastly, check for circulation. Do they have a pulse at all? A pulse is the heart beating, but you can feel it in a different part of their body because it's going through the veins and the arteries. You do not even need to know what a strong or a weak pulse is. As long as their heart is beating, the patient is in better condition. Ideally, checking all of these, each of your ABCs, this should only take you between 5 to 15 seconds. Timing is crucial when it comes to CPR. Next, you will need to determine if you need to perform CPR. So you're going to go through your ABCs. Is anything blocking their airway? No. Okay, move on to breathing. Is their chest moving, or do you feel air coming out of their nose or mouth? Again, no. Lastly, check their circulation. This can be checked at the wrist or even at the carotid artery along the neck, which is a very strong and very common artery. No? All right. Now it is time to start CPR. Many people will doubt themselves at this point and think that they have missed something. Okay, take a step back. You've already sent someone else to find the AED, so apply the AED. The AED is foolproof and will walk you through all of the steps you need to know. And you don't have to worry, it will not shock the person if they do not need to be shocked. Once the AED is turned on, it will tell you everything you need to do. For example, it will say, take off the victim's shirt and expose bare skin. Plug in pads. Apply pads like shown on the picture. Stand clear, analyzing. At this point, the AED is also essentially checking the ABCs of the individual. If the AED thinks the person is in need of a shock, it will again tell you to stand clear, and you will be the one to push the button. The AED will not send it on its own. Then it will analyze again, and depending on the results, it will instruct you to begin CPR. That's the basic knowledge you need to know on CPR. The next important step would be how to perform the actual function of CPR. For CPR, the victim is unconscious, unresponsive, passed out. Ideally, they are on the floor, on their back. When they are in this position, you will be able to successfully assess their ABCs and then perform CPR. There are two parts to CPR: chest compressions and breaths. According to the Indigo medical training, unless the person administering CPR is a medical professional, the chest compressions are the only part that will need to be done. Chest compressions move blood to the brain, which is crucial for survival. The breaths will allow some extra oxygen to go into the body, but if it takes too much out of the helper, or if the person providing CPR is not comfortable, chest compressions are enough. To perform CPR, specifically the chest compressions, the administrator will kneel on the side of the patient. Their knees will be in line with the victim's shoulders. The helper will then interlock their hands and extend their elbows, locking out their elbows as well. Then they will place their hands palms side down, on the center of the chest below the victim's nipple line. You will place your hands firmly on the chest and apply fast and hard compressions. The best way to keep beat with the compressions is to compress to the tune of Staying Alive. The song goes bum, 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 bum. And that will help you keep pace and tempo of how fast these compressions need to be. When administering breaths and compressions, you will perform it with the ratio of 30 chest compressions and 2 breaths. Regardless, chest compressions or chest compressions and breaths will be applied until EMS arrives or the state of the victim has changed. I know CPR is scary and people passing out is hard to handle sometimes, but being prepared, especially as a teacher, can give you confidence and give the students the security in the classroom that they need. Timing is everything when it comes to saving someone's life. So the more the teachers know about CPR, the faster they will be able to respond and the higher chances this person will have at surviving. Thank you.